Dr. Schaffel, you've very clearly described 17 separate, distinct, egregious violations of the standard of care, further noting that 4 of those were not only egregious but fundamentally unethical and unconscionable. Is that accurate?
I'm trusting you on the math here. I haven't kept track, but that sounds right to me.
You want to check?
I haven't.
Well, let's assume that's the egregious violations of the standard of care. The lack of the basic emergency airway equipment.
Yes.
The lack of the more advanced emergency airway equipment.
Yes.
The lack of suction apparatus.
Yes.
The lack of an infusion pump.
Yes.
The lack of pulse oximetry.
Yes.
The lack of and failure to use the blood pressure cuff.
Yes.
The lack of electrocardiogram.
Yes.
The lack of capnography.
Yes.
The failure to maintain a doctor-patient relationship.
Yes.
The failure to continuously monitor the mental status of the patient.
Yes.
The failure to continuously monitor the breathing of the patient.
Yes.
The failure to continuously monitor and have available the blood pressure, pulse oximetry, and heart monitors to maintain constant vigilant monitoring.
Yes.
The failure to call 911 immediately. The failure to chart and document at the outset of the procedure.
Yes.
That is both egregious and unconscionable.
Yes.
The failure to maintain written informed consent, again, both egregious and unconscionable.
Yes.
The failure to document throughout the course of sedation, again, egregious and unconscionable.
Yes.
And the failure to disclose to both the paramedics in UCLA the use of propofol and the facts surrounding what Dr. Murray claimed to be a witnessed arrest.
Yes.
And when I total those up, I come up with 17 egregious violations, 4 of which are also unethical and unconscionable. Is that accurate?
Correct.
Is that accurate?
Yes.
Now, you described at the outset of your testimony that your use of the term egregious equates to that individual deviation from the standard of care being expected and or likely to result in a catastrophic outcome, namely injury or death to the patient, Michael Jackson, correct?
Yes.
Would you agree that each one of these 17 individual violations individually were likely and should have been expected to result in injury or death to Michael Jackson?
Yes.
And in your mind, was that completely foreseeable risk?
Yes.
I want you to assume the same facts that you've analyzed from the evidence. Let's assume Conrad Murray gave this polypharmacy of drugs to a dehydrated, exhausted patient who may or may not have fasted. And let's assume Conrad Murray gave 25 milligrams of propofol and walked out of the room. And let's just assume for the sake of the hypothetical that Michael Jackson was then either ingested lorazepam and or ingested propofol. Would it still be your opinion that Conrad Murray is directly responsible for the death of Michael Jackson based on his at least 17 egregious failures in the standard of care and his abandonment of Michael Jackson?
Absolutely.
And would those risks that a patient could consume propofol and or lorazepam when abandoned, would those risks be, in your opinion, foreseeable, requiring the doctor to not abandon such a patient?
Yes.
Dr. Schaffel, you spoke about the fundamental importance and the trust inherent in a doctor-patient relationship. And I want to ask you, as it relates to the standard of care in this case and the summary of the violations of the standard of care that you provided us, if you could put this into perspective as to what it is that Conrad Murray did to Michael Jackson and how it fundamentally violated the doctor-patient relationship.
I'd be happy to. The doctor-patient relationship, I believe, goes back to the dawn of civilization. I was in Egypt a year and a half ago, and on stones dating back thousands of years, you can actually see carved medical instruments that are recognizable today. So this relationship is a hallowed relationship. Doctors are permitted to know the most private details of a person's body. Doctors are permitted to know the most private and personal details of a person's life. Doctors are permitted to give very powerful drugs, drugs that might harm a patient or might kill a patient. Doctors are permitted to use knives and cut into a patient's body to remove a cancer or to repair an organ or to replace a knee. Doctors are allowed to do these things because of a hallowed relationship between the doctor and the patient. And if I may, I'd like to just give 3 observations of this. Doctors are associated with something called the Hippocratic Oath, dating back to 500 years BC. And to quote from it, "In every house where I come, I will enter only for the good of my patients." Because at the core of the doctor-patient relationship is that you put the patient first. That is the cornerstone of this hallowed relationship. It is because you put the patient first that you are entrusted with surgery, with dangerous drugs, with intimate knowledge of the patient. Quoting from the Declaration of Geneva, a more modern document, "The health and life of my patient will be my first consideration." That is at the core of the doctor-patient relationship. And finally, I have to quote Columbia University Medical Center, 4 words, "We put patients first." When Dr. Murray agreed to treat insomnia with propofol, he put Dr. Murray first, not Michael Jackson. When he showed up every night with bottles of propofol and bags of saline, he was not putting Michael Jackson first. He was putting Dr. Murray first. And in the emergency room at UCLA Medical Center, when he misrepresented the type of arrest that it had been and withheld information about the drugs that had been given, he was not putting the patient first. He was putting Conrad Murray first. This is the fundamental violation. The patient comes first. That did not happen here.
Mr. Walgan, at a convenient time, let us know for purposes of the adjournment.
Did Conrad Murray continuously and repeatedly violate these fundamental tenets of the doctor-patient relationship?
Yes. Every night, these tenets were violated.
Thank you, Your Honor.